Doc, Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. In today's topic, what to do about hypertension in pregnancy. What are the guidelines for blood pressure?
Well, it depends on who you listen to, but of course, I have to listen to ACOG, which is the American College of Obstetricians and Gynecologists. And no, they consider normal less than 120 over 80. Slightly elevated is more than 120, 120 to 129 over more than 80. Stage one is 130 to 139 over 80 to 89. And stage two, hypertension is more than 140 over more than 90. So ACOG doesn't recommend treatment until stage one, which is 130 to 139. I have always recommended treating earlier, and sometimes it's just a matter of modifying activity, not necessarily always giving medication.
How often should your blood pressure be checked in pregnancy?
Well, that depends on what your blood pressure is and who you are and who your doctor is, but every visit for sure, and that can be every month in the beginning, every week at the end. But if you're watching blood pressure, if you have a reason, if you and your doctor have found that there's a reason for having that your pressure is elevated, then you need to check it twice a day at home. And that's a relatively easy thing to do. And that is explained in our book, Pregnancy Your Way.
What does one high blood pressure mean?
Well, I've always chosen, as I've said several times today, that one elevated high blood pressure is our warning sign. That is at the time when we have the most opportunity to course correct. So, rechecking pressure till it comes down is a fool's game. And again, one single elevated blood pressure is our opportunity to provide good and safe prenatal care.
What do you do with one elevated blood pressure?
Well, of course, I would say it's the first sign of hypertension or preeclampsia. Get yourself a home blood pressure cuff. I'd say, there's three kinds: expensive, less expensive, and least expensive. I'd get the middle kind. And in order to check your blood pressure, you sit in a chair with your feet flat on the floor, put your blood pressure cuff on your left arm, not your forearm, but your arm, and then keep it at about the level of your heart. Rest your arm on the table or something, because if you just hold it by itself, your pressure will be too high. But there's nothing wrong with holding your um, left arm with your right arm. And if I think that a mom is getting hypertension or preeclampsia, I check some labs, a CBC to check a hemoglobin, hematocrit platelets, and then a CMP or comprehensive metabolic profile to check kidney functions, creatinine, BUN, liver functions, and of course I check reflexes and protein.
How do you check your blood pressure at home?
Yeah, again, it's feet on the floor, sitting straight up, blood pressure cuff on your arm, and at the level of your heart.
If you have one elevated blood pressure in pregnancy, you're checking your blood pressure at home twice a day. Is there any other treatment you recommend?
Well, that depends on, if your pressure goes up, I would recommend then modifying your activity. For example, if you're working three 12-hour shifts, I'd recommend cutting back to, say, 4 or 5 8-hour shifts, and then continuing to watch your blood pressure.
What would be the first activity modification would you recommend?
Again, it is once you're monitoring your pressure at home, it's modifying activity.
At what level of blood pressure in pregnancy should you start treating?
Well, ACOG says a bunch of different things, but in one place they say 140 over 90 or higher, and that's certainly, I would say, the highest. There'd be, as far as I'm concerned, no reason to not start treating a little bit earlier. But again, it depends on what your blood pressure reading is in the beginning. Certainly if you start out at 100 over 50, 140 over 90 is very high, and you need treatment before that time.
Does having high blood pressure increase your risk for having preeclampsia?
I think it does most of the time. However, just because your pressure goes up doesn't automatically mean that you will develop preeclampsia.
Does taking low dose aspirin prevent preeclampsia?
Well, it is said to do that. There's a bunch of information out today that says everybody should take a baby aspirin. You know, it's an 81 milligram aspirin. Every pregnant person. On the other hand, if you look at ACOG, which is always conservative, they try to limit it for people who are at risk, you know, had preeclampsia before, or for people, especially Afro-Americans who tend to have higher blood pressure anyway.
What if you have high blood pressure? What can happen to your baby?
Well, the biggest problem is that you run the risk of running out of oxygen or running low on oxygen and running low on nutrition. And of course, your baby needs those things to grow. So if it doesn't get enough, it doesn't grow enough. So your baby turns out to be small for gestational age.
All right. The best place to go is worlddocallen.com and pick up Pregnancy Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right. That was World Doc Allen podcast, guys. Take care.